Dr. Jha, I want to start with you. You have said that we're just starting the Delta surge. What are you watching for? What can we expect? And how concerned are you about the surge among those who are unvaccinated, then spilling over into those who are?
Yeah, Alicia, thanks for having me back here. I am really concerned about where we are as a country. The surge is just getting going. We have quadrupled the number of daily infections just over the last few weeks, and we're nowhere near done. So we're at about 40,000 new infections a day. I think we're gonna get to 100,000 new infections a day at some point over the next month or so, and probably keep going. This is largely affecting unvaccinated people, but the truth is that unvaccinated and vaccinated people mix. They mix in grocery stores and restaurants. And vaccinated people are getting breakthrough infections because there's so much virus in the community because of the high rates of unvaccinated. So it's a really complicated situation. Vaccinated people still remain relatively safe from severe illness, but until we get a lot more people with the shot in the arm, it's going to be a very tough ride for us.
Right. Dr. Jha, a new poll out this afternoon from the Associated Press shows that the vast majority of unvaccinated Americans say they probably or definitely won't ever get vaccinated. Is there anything experts and officials can still do to try to break through to them?
Absolutely. I think there are some people who are still on the fence. I also think what is going to move most people, and by the way, we've done this with lots of other vaccines, is mandates. I don't mean from the government. I mean from companies and businesses and schools and universities. My university has a mandate. If more and more places did that and people had a choice, you could go to your job or you could get and be vaccinated or you could not. Most people, I think, who are not vaccinated would jump off the fence and get vaccinated. The true core of anti-vaxxers is actually quite small. We just have to help other people get over the hurdle.
Okay, so to that point, Carlos, 10 states still have less than half of their adult population fully vaccinated. 9 of those 10 have Republican governors. 28 states, mostly Republican, are below the national average of adults fully vaxxed. But then you see Republicans, as we're showing you in that lead, in a press conference supposedly aimed at promoting vaccination, surrounded by doctors, further politicizing the issue by blaming COVID origins. I mean, how do you reckon with that abdication of responsibility, that level of complete disregard for public health outcomes?
Alicia, you mentioned it. The sin was politicizing this. You can respect people's healthcare decisions. You can encourage people to get vaccinated while understanding that some may choose not to. But once you politicize it, once you make people believe that in order to be real conservatives, they shouldn't get vaccinated, that's when you're crossing a line. And Republicans did that. They've done that to try to criticize President Biden. And even when he was running, they tried to politicize this. And now you're seeing a lot of them change course, come back and say, wait, no, I mean, this is important now. You should do it. But it is too late for some people already. And I think some of these Republicans are starting to wake up to the reality that it's their voters that are passing away, that are getting really sick. So it's a shame that it took this situation to get people to stop politicizing this. But that's just the kind of politics that we have to live with.
Well, Eugene, you underscored this point in a column writing, what used to be the conservative movement in this country is becoming a death cult. The measure of its power is less in ballots cast than in how many people die needlessly in service of this twisted worldview. The problem, of course, Eugene, is that they're not just threatening their own lives, they're threatening the lives of everyone they're in community with.
That's right. And it's, it's not only, in my view, immoral what they're doing, what Republican politicians are doing, but it's completely incoherent because they're saying, well, you should be giving Donald Trump credit for the vaccines. Okay. Operation Warp Speed, he green lighted that and a whole lot of money. And so great. They're saying that we should be pointing the finger at China, and maybe it escaped from a lab. Maybe it did. Let's look into that. Absolutely. But none of that has to do with whether people protect themselves and what's going to happen. I fear, and Dr. Jha is the expert, of course, but it certainly sounds like thousands and maybe tens of thousands of people are going to die. Who don't have to die, and who shouldn't have to die, who can get the vaccine. It's readily available everywhere. It's incoherent and it's self-destructive, and it's such a shame. So bravo to Governor Ivey, but where are the rest of them?
Yeah, I mean, Dr. Jha, this is why we keep circling back to this question about the message and the messenger. On her podcast recently, Molly Jong-Fast asked, would we be looking at a different country right now if Tucker Carlson told the world he'd been vaccinated? To what extent, Doctor, is the mixed messaging and the just asking questions about the credibility of science making all of this then an unwinnable war?
Yeah, there are two parts of this, right? I mean, for one is that for a year, a lot of people have been downplaying the virus, saying it's nothing worse than the flu. It's just the sniffles and the cold. So that sets up a pretty tough context in which to encourage people to get vaccinated. I mean, who needs to get vaccinated against the cold? And then now they're just raising questions and really making up nonsense about the vaccine. And so a year and a half of this campaign, it's going to be pretty tough to reverse. I think it'll happen. I think people will see their loved ones getting sick, and I think that'll motivate, obviously, people. I think mandates from businesses will motivate people. But we've just built up this really difficult barrier that we've done to ourselves, or a subset of people have done that. And now we've got to figure out how to climb that hill.